Hello again everybody and welcome to my YouTube channel. Today I'm going to be talking to you about a controversial subject, CBD or cannabidiol, and its role in the management and treatment of mental disorders in children and teenagers. My name is Tracey Maxfield. I'm a retired nurse, peer specialist, author, educator, and staunch stop bullying and mental health advocate. So it seems like for the past year there's been a lot of talk about CBD or CBD oil, more commonly, or cannabidiol. It's on the news, it's all over social media, and there's so many times that I actually go to Facebook or Instagram and see either an advertisement or a sponsored feature, or even parents touting the effectiveness of CBD oil in the treatment of their child's anxiety or depression. Now, I do have a number of concerns about this. Mainly it's because very little research has actually been done into the effectiveness of CBD oil in children and teenagers. So what I want to clarify is that this video is not a personal comment on CBD oil. What I'm doing is giving you facts and suggestions as parents, guardians. You can make a safe, informed decision about whether or not you feel it's worth exploring the potential of CBD oil for help with your child or teenagers' anxiety issues, mental disorder, etc. So, as I've mentioned, very little studies have been done. Mainly, the studies that are saying that CBD oil is very effective in relieving anxiety and helping with behaviors and hyperactivity, and it promotes calm and restful sleep. These studies are mainly anecdotal, and the actual research studies have been conducted on animals. And so to date, no studies have actually been conducted on children and teenagers to note whether or not it is useful and effective. Certainly, there's been a lot of research and a lot of documentation about the effectiveness of CBD oil, as we know, in pain management, for cancer treatment, for chemotherapy, and many adults and older people say it's great in helping them reduce stress and anxiety and actually promoting restful sleep. What we do not know is, because a child or teenager's brain continually grows and develops until ages 21 to 24 in females and 24 to 27 in males, we don't know what effect it has on the brain and then ultimately on the body. Now, I just recently read about how awesome it was in helping a 10-year-old girl with anxiety, and similarly a 17-year-old boy with depression. And whilst it's really great to read the positive effects it's had, and that these children, or teenagers I should say, are now in recovery mode, what we have to remember is we don't know the specifics. We do not know if there was an accurate diagnosis of a mental disorder. We do not know if any treatment options were tried beforehand. We don't know their ACE score, if they have pre-existing mental or medical conditions. We don't know their socioeconomic status. We don't know if they're on any other medications. There's lots of factors that need to be considered first before you just, reach for CBD oil or gummies and start giving them to your kids. Now, Dr. Paul Mitrani, who's a pediatrician, he's a child and adolescent psychiatrist and clinical director at the Child Mind Institute. His opinion is, and I'm going to quote it, "In regard to treating mental health disorders in children and adolescents, there's lack of evidence to support its use. And I urge parents to wait until further research is done before giving a child or teenager CBD." Now, to date, the only marijuana-derived drug that has been approved for use in children is Epidiolex, Epidiolex, which is used to treat a rare and very severe form of epilepsy. The good news is that in 2018, clinical research has been approved on the use of CBD in studies on pain, anxiety, cognition, and movement disorders, primarily in adults, but they are starting to look at children and teenagers. So let's begin. What exactly is CBD or cannabidiol? Well, first of all, it's one of over 100 chemical compounds or cannabinoids found in the marijuana plant, and actually CBD is the second most prevalent of the active ingredients of marijuana. And while CBD is actually an essential component of medical marijuana, it is actually derived from the hemp plant, which is a cousin of the marijuana plant. Now, CBD is different because it does not contain THC, and I gotta look at this to pronounce it, tetrahydrocannabinol, which is the chemical in marijuana that makes one high. According to the World Health Organization, in a very detailed document that they started in 2017 and concluded in 2018, they said in humans, CBD exhibits no effects indicative of any abuse or dependent potential. To date, there is no evidence of public health related problems associated with the use of pure, remember this, pure CBD. So CBD can be administered in an oil, and that's usually not only for ease of administration but to take away the taste, and it's usually administered in capsule form or under the tongue. You can do it in gummies. Now, I do urge you that if you do start giving your kids gummies, CBD gummies, remember they are CBD gummies, and so you want to put them in a safe, secure place. They're not candy, even though they taste like candy. You can also get CBD in transdermal patches, and this allows the CBD to penetrate through the skin into the bloodstream without actually going through the digestive system. And it can last for up to a period of 96 hours, so it provides a consistent and constant level. So that's another thing worth exploring, and it's actually very good for pain or nausea management. Now, the possible side effects when you start administering CBD to a child or a teenager would be something like drowsiness, maybe nausea or change in appetite, maybe a dry mouth if you're doing it orally, diarrhea, irritability. The good thing is that these side effects are usually mild and transient and usually disappear after a couple of weeks. So because of the limited research and because of so much information and anecdotal information that is on the World Wide Web, and remember, just because it's on the World Wide Web does not mean it is true and does not mean it is proven. I think what you need to know, what we know as healthcare professionals, as researchers about CBD in children or teenagers, is that clinical doses have not yet been determined. That's a huge factor. They also may interact with other medications. So we remember years ago there was a lot about taking medications with grapefruit juice and it was a contraindication and could actually impact the absorption. The same is true with CBD. So if you are taking any medication that says do not take with grapefruit juice, then you cannot take CBD with those medications. It has the same interaction effect. That's an important point to make. CBD products are unreliable in delivering a consistent amount of CBD and may contain other ingredients which may be harmful. So again, you need to know what's in the gummies or the oil that you may be administering to your child or teenager. As I mentioned earlier, very little is known about how CBD is delivered to the brain and how much it is. And what we also know is that absorption rates will vary. So if you give a gummy versus oil on the tongue versus a transdermal patch, the CBD oil is going to be absorbed at different rates. And so again, absorption, the route that's used, and the dosage is imperative. I know some people are probably saying go lowest and then build up. And again, remember size. If your child is larger than normal children, but if they have any hormonal or endocrine problems or metabolic disorders, this is all going to impact how it's absorbed and its effectiveness. And so I do urge you to think about all these things before you administer. Now, I think one concern that lots of doctors have, and I have, is that lots of parents are now giving their child or teenagers who are maybe a little down or sad but don't really have clinical depression, or they may be a little stressed or anxious, like at exam time, or they may have difficulty sleeping. They're now giving their child or teenager CBD. The problem is that if you give it long term, the child becomes reliant, and even though they're sleeping, if you then decide to discontinue the CBD, they may have significant sleep problems that may be worse than the original sleep problem they had if you discontinue it. So again, err on the side of caution. So to all parents, guardians, family members, if you are thinking that maybe your child or teenager would benefit from taking CBD, maybe you're taking it or you know somebody and it's had a great effect. The first question I want to urge you is to ask yourself why. Why are you choosing to go this route? And then I would encourage you to follow up with the pediatrician, the physician, the pharmacologist, or the psychiatrist. You really need to be talking to them and explore. Should it be given? How long? What kind of dose? What are you looking for? What is the outcome? I think learn the facts and learn them from reputable people. Remember, CBD is touted as a magical, miraculous cure. That may be so, but we don't have the proof yet. And remember, you are putting something into your child or teenager's body. Now, yes, it may be natural, but again, we don't know how it interacts. And remember, a growing, developing brain and body. So know the facts. Other factors is, why are you giving it? Are they depressed? Are they anxious? So look at the problems, look at the core roots. What is going on? Do not use it as a treatment because they have an issue without actually exploring what is going on with them. Have they received a diagnosis of a mental disorder? Do they have serious sleep problems that are impacting their ability to function? You need to explore this with a physician first and then look at options. If they are taking medication already for the mental disorder and you feel it's not being effective, then talk to your doctor. Don't just discontinue the medication because that can have detrimental effects. But similarly, don't just add in the CBD. Be cautious. Another thing is, if there is a treatment plan which includes CBD, like cognitive behavioral therapy or other therapies, continue with that. You still need to deal with the root cause of the problem, of the anxiety or the OCD or the depression, and try and help the child or teenager manage that and move forward in their life. Another thing is buyer beware. Where are you getting this from? If you're getting it online, you cannot guarantee that the ingredients is pure CBD. So this is another factor. You really need to know your source, and then you need to check the ingredients, what is added in, and you have to ensure that they haven't added in a trace of THC. So when you think your child is getting better, it's actually the THC which is giving them the mild high. Another thing is, can you afford it? CBD is not covered to date by medical insurance plans. And so if this is something that actually is working and is effective, can you continue to purchase it and administer it to your child or teenager long term? So that's another factor. I think another thing is, if you do decide and you find a reputable person, then you need to monitor not only from the side effects, but is anything else going on? Are they getting better or are they getting worse? And you really need to document this, because when you follow up with a physician, you need to go and say, okay, so he was really, really depressed, and he's been on CBD now for 3 weeks, and I'm noticing that his mood is getting much better, but he still seems drowsy. Again, we all want to support you in doing the very best for your child or teenager and for helping promote a healthy mind and a healthy body. So please be very cognizant of any sudden changes in behavior, which could be more detrimental. And if you're noticing these changes and you're concerned, then you need to follow up with the doctor, or if it seems like it's imminent, then you need to go to your emergency department. Now, obviously, there's been no documented cases where somebody has been taking CBD and suddenly became suicidal, as opposed to, sadly, some antipsychotics and some antidepressants where this has been documented to happen. But again, you're putting a medicinal drug into your child or teenager's body. You treat it as if it is any other drug, and so you want to monitor side effects, symptom changes, behavior changes, for better or for worse, and follow up accordingly. So I hope this information has been a little bit of help in just getting you to think, and then if you continue to decide, you know what, I really want to give this a try, then what to look for, what to monitor, and what to do. And I'm really hoping that we get some bona fide research done, so if it is proven to be helpful, and I think it will be, that we can have some standardized doses and the best method of administration, so then we can start using that as a management treatment option for our kids, because we don't want them to suffer. We don't want them to go through life thinking that nothing will help and they'll never get better. So again, please proceed with caution, use common sense, research, check your sources, administer, and follow up. Thank you.